Hello friends, a good day to all of you. I am Dr. Sirish Nelivigi, Director and Consultant Ophthalmologist, Nelivigi Eye Hospital, Bellandur, Bangalore. Welcome to my YouTube channel, Let There Be Sight. Welcome to one of our illuminating series, which will open your eyes towards some of the very interesting topics in ophthalmology. Today, we are going to talk about one important and frequently asked topic, which concerns children. Nowadays, you must be seeing a phenomena where more and more children are ending up wearing glasses. Not only are they wearing glasses, they are ending up with higher and higher powers and more rapid increase in the extent of power. Therefore, hence comes the question from all the parents and the children themselves, how do I stop this power from increasing? This is one of the most often asked questions in our OPDs today. To break up this topic and to give you some idea about it, let me tell you that the power increase in children, there are two things which you need to keep in mind. One is the modifiable risk factors for power increase. Another is the non-modifiable risk factors for power increase. What are the modifiable risk factors for power increase? They are factors like physical growth. They can be factors like genetics. It can be factors like heredity. It can be factors even like puberty. These are things which we cannot modify or change it from our side, because the growth happens as it should, your age increases as it should, and the other physiological changes that happen in the body are unalterable by us. Therefore, let us pay our attention to the modifiable risk factors. The modifiable risk factors are those where actually you can do something about the power increase, and let us just concentrate on these things. There are only three things which you can do to either slow down or stop the power from increasing. So what are they? Point number one, the more amount of near work that you do, higher is the chance of your power increase. So what is near work? Any work that is happening within an arm's distance from your eye is called as near work. So let us say this is roughly about 50 to 60 centimeter distance from your eye. What is this near work? It can be any work which happens in this zone, and the type of work is immaterial. It can be a digital display which you are looking at. It can be a non-digital display. A digital display can be something like a mobile phone or a computer, and a non-digital display can be anything like a book or novel or anything else that you are doing in that zone. So it is the number of hours that is spent doing work in this zone that is important. So for example, if you are there is one child who is spending about 6 hours doing near work as compared to another child who is spending about 10 hours doing near work per day. The child spending more number of hours doing the near work has a higher proneness in having an increase of power as compared to the other child. There is no nomogram or a cutoff as to how much of near work is allowed per day, but remember that lesser the number of hours you use per day in doing near work, better is your chance of either arresting the power or slowing down the power increase. That was point number one. Coming to point number two. The point number two is, higher the amount of time that is spent outdoors, better it is for your eye. Or conversely speaking, higher the amount of indoors time you spend, higher is the power increase chance. So be outdoors, expose yourself to the outdoor air and to the distance that is the outdoor. That means relax your eyes by seeing something very far. This is what is going to help you either to slow down the power or to arrest the rapid increase in power. I told you in the beginning that there are three things which you can do. These were the first two things. The last one is a pharmacological modification. What is a pharmacological modification? There are some eye drops, especially eye drops, which is called as atropine, which can be used to reduce again the speed of increase of power. Now we use atropine in very minimal concentration and is given regularly. This eye drop can be helpful in achieving our aim, but keep in mind this can be useful only when it is used over a long period of time. Use of those eye drops for about a month or two may not be sufficient. You will have to use it for months or years together. Is everybody fit for using the atropine drops? I would say no. As far as the third modification is concerned, that is putting the eye drop to reduce the speed of increase of power, I would suggest that you please consult your ophthalmologist After a detailed checkup, he will give you the opinion whether your specific child is fit enough to use the eye drop to cause this modification to lessen the speed of increase of power. I hope this information was helpful to you in taking your decisions. Before I wind up, let me tell you, there are a lot of modifications, lot of suggestions which are offered on the YouTube channels by plenty of people. Believe me, none of them have been proven by science to help in achieving our aim of stopping the power. Let me give you a short example. For example, exercises are touted by a lot of people that it's going to help. None of the exercises scientifically have been proven to do that. Lot of other medications have been told to do that. Unfortunately, it doesn't do it. Carrots have been believed to decrease the power. No, it doesn't. And then there is a very common myth who think that wearing glasses will either stop the power or not wearing glasses will stop the power from increasing. Believe me, none of them have any scientific backing or basis. Just remember those three things that I told you, and they are the things which are going to help achieve our objective of slowing down the power. I hope this was useful to you and it helps you in giving you the right direction in making the decision for your child. Have a great day and thank you.